those joining us live and to those listening in afterwards. I would also like to warmly welcome our guests today, whom I will shortly introduce. Our webinar today is titled Mental Health Screening, Referral and Support by Pharmacists. As mental health problems become more prevalent, this event will address the role that pharmacists can play in integrated interprofessional care. Through early screening, effective referral and support of people with mental health conditions. Attendees will gain insights into the latest screening tools that enable pharmacists to identify individuals at risk and refer them to appropriate resources. In addition, the event will explore the pharmacist's role in providing appropriate support and counseling to patients and working with healthcare teams to promote holistic mental wellness. Through this event, FIP hopes to empower pharmacists to transform mental health care. Next slide, please. I would like to apologize on behalf of our dear Vice President, Mr. Lars-Åke, for not being able to chair this event today. Unfortunately, he has been infected with influenza A, which caused him to lose his voice. The FIP team wishes him all the best and hopes that he will continue to recover. So today I will do my best to moderate this event. My name is Inês Nunes da Cunha, and I am the FIP Practice Development and Transformation Project Manager. For this event, we are joined by a panel of fabulous speakers, and I want to sincerely thank each of them for taking the time to prepare their presentation. We have Dr. Claire O'Reilly from Australia, Dr. Ellie Gorton from the United Kingdom, and Dr. Sheila Ferreira from Brazil. As you can see on this slide, we have some announcements. Please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage all the questions so that at the end we will be able to address those questions. You are welcome to provide feedback to webinars@fip.org. And I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or pharmaceutical scientist and you would like to become a member, please register on FIP website at fip.org. Today, we are offering a Brazilian Portuguese translation, which is available on Zoom by clicking on the interpretation icon. Can you please show me the next slide, Gonçalo? The next one, please. Yes, on this icon, you can choose Portuguese or English translation. FIP wish to thank Viatris for supporting this event through an unrestricted grant, like you can see on the next slide. Thank you for supporting this event today. And for our program today, first, I would like to briefly introduce you to the FIP Practice Transformation Program on Non-Communicable Diseases, NCDs, with a focus on mental health. Next, Dr. Claire O'Reilly will present the role of pharmacists in mental health screening, improving early detection and intervention. Dr. Ellie Gorton will present mental health referral pathways, equipping pharmacists to refer patients to appropriate support services. Dr. Sheila Ferreira will talk about the role of the pharmacist in mental health support, an example from Brazil. And lastly, you will have the opportunity to ask questions, and our panelists will make some closing remarks. Today's learning objectives. We have a different number of learning objectives for this webinar, and attendees will learn about the role of pharmacists in mental health screening, referral, and support, and how they can contribute to holistic patient care. Some examples of mental health screening tools and techniques used by pharmacists to identify early signs of mental health conditions in patients. You all also learn about the importance of timely and appropriate referral to mental health professionals. And finally, you will learn about the essential role of pharmacists in providing empathetic support and counseling to individuals with mental health conditions, promoting a patient-centered approach to care. Next slide, please. Non-communicable diseases, NCDs, like diabetes, cardiovascular diseases, cancer, chronic respiratory diseases, and mental illnesses are the leading cause of disease burden and mortality around the world, across all country income levels. And according to the World Health Organization, these 5 NCDs cause nearly 3/4 of deaths in the world. And every 2 seconds, a person under the age of 70 dies of NCDs. And 86% of those deaths occur in low and middle income countries. So the FIP Practice Transformation Program on NCDs is a flagship project that aims to deliver FIP commitment to the WHO Astana Declaration and to the primary healthcare agenda with a focus on non-communicable diseases. The FIP program on NCDs aims to provide tools and strategic support to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimization of NCDs for improved patient outcomes and health systems efficiency and sustainability. While this program has a particular focus on low and middle income countries, it also encourages implementations by countries of all income levels. As you can see on the next slide, the programming includes the development of practice support handbooks, knowledge and skills guides, implementation guidelines, and support and training for competence development in each of these 5 disease areas, and also risk factors like tobacco use. On the next slide, you can see the handbooks and also the knowledge and skills guide that we have already published, and I highlight the handbook and the KNS guide on mental health that we will focus today. It is acknowledged that there are many opportunities for pharmacists to engage in mental health care and provide services to their patients, ranging from prevention to screening to management and much more. With the proper knowledge and skills, pharmacists will be well positioned to address the global burden of mental illnesses and promote mental health and well-being in their communities. So, with the handbook that you can find on our microsite, we have the aim of for pharmacists on mental health. The aim of this handbook, is to identify and describe key evidence-based interventions by pharmacists in this area, with the dual aim of supporting their implementation in pharmacy practice and supporting advocacy efforts by FIP member organizations towards the optimization and expansion of pharmacy scope of practice in mental health and NCDs in general. On the next slide, you can see the knowledge and skills reference guide. This guide aims to outline the knowledge and skills recommended in mental health care for pharmacists. also aim to provide a structure to support and enhance pharmacists' CPD in mental health care, and to highlight key considerations for CPD providers and educators in the area of mental health to support pharmacists' professional development. All publications, these two tools, and all publications related to the program on NCDs, such as handbooks, KNS guides, recordings of the digital events and other resources can be found on the NCD microsite. Gonçalo, please show the next slide. Thank you so much. You can have the QR code if you want to use right now your phone, and please check this website for updates. Next slide, please. So today's event is a celebration of the World Mental Health Day, which takes place tomorrow under the theme Mental Health is a Universal Human Right. This day is an opportunity for people and communities to improve knowledge, raise awareness, and drive actions that promote and protect everyone's mental health as a universal human right. So next slide, please. Before I hand over to our speakers, I would like to invite you to answer 3 questions to test your knowledge of some of the topics they will be discussing today. So the first question is, which of the following in relation to the global prevalence is incorrect? A. Suicide is the leading cause of death globally among people aged 15 to 19. B. Prevalence estimates of anxiety and depression increased by more than 25% in 2020. C. More than 75% of suicide deaths globally occur in lower middle-income countries. Or D. 970 million people globally live with a mental illnesses. Please, Ellie, can you add the poll? And I will give you some time. We are still receiving some answers. More 5 seconds, and I will end this question. Thank you so much. Ellie, can you show us the results, please? Thank you so much. The second question. The second question is, which of the following is not a key pillar of the WHO suicide prevention live life framework? A. Limiting access to means. B. Interacting with media on responsibly reporting. C. Avoiding engaging young people. Or D. Early identification and support. We are still receiving lots of response, so I will give you some more time. We are still receiving answers. Thank you so much. Ellie, can you please show us the results? So, thank you so much. And the last one, please, Gonzalo, can you show us the third question? Thank you. So the last one is, in relation to pharmacists working in mental health, which of the following statements is correct? A, there are many studies have been derived from developing countries. B, in Brazil, there are recommendations in official government documents that guarantee the presence of the pharmacist in mental health teams. C, there are studies of patients with mental illnesses showing that pharmaceutical care contributes to the achievement of therapeutic goals like medication adherence, treatment satisfaction, and reduction of depressive and anxiety symptoms. Or C, international institutions don't have supported and encouraged the introduction of pharmacists into multidisciplinary healthcare teams in mental health. I will give 1 minute. We are still receiving lots of answers. Thank you. So, Ali, can you please show us the results? So, thank you so much. Now, thank you for your participation. This is so great. At the end of this event, I will do the same 3 questions to see if your answers will change with the speaker's presentation. So now I will introduce our first speaker who will provide the presentation on the role of pharmacists in mental health screening, improving early detection and intervention. Professor Claire O'Reilly is an associate professor at Sydney Pharmacy School, pharmacist and master mental health first aid instructor. Professor O'Reilly is considered a national leader in the area of pharmacists' roles in mental health care and has led various research projects, policy initiatives, and established evidence-based training programs to enable pharmacists to have an enhanced role in support and care of people living with mental illnesses in Australia. It is a great pleasure to have you so late because in Australia is midnight. So it is a pleasure to have you here with us, and I will give you the floor.
Thank you. Thank you very much, Inez. I hope everybody can hear me. Welcome. It's really lovely to be here with you, even though it is the middle of the night in Australia, but it is wonderful to be here on officially now World Mental Health Day in Australia to share with you this presentation this evening. So firstly, this is an overview of what I'm going to cover in my part of the session tonight, which is firstly an overview of the increasing prevalence of mental illnesses worldwide. And then the focus will be talking about how pharmacists can act as a frontline screener. So someone who has the opportunity to recognise some possible signs or symptoms of a mental health condition and think about how we can identify and refer those people appropriately. And to do that, we can often use screening tools and I'll go through a few evidence-based screening tools that you may like to incorporate into your practice. So firstly, let's talk about the prevalence of mental illness globally. So the estimates from WHO in 2019 estimate that more than 970 million people are living with a mental illness. And some figures during the COVID pandemic is estimated that approximately a quarter or 26 to 28% increase during that time in the prevalence of anxiety and depressive disorders during 2020. Globally, definitely anxiety disorders and depressive disorders are the most common mental illnesses, and they're one of the leading causes of disease burden globally. If we specifically look at rates of suicide, globally the rates are over 700,000 people per year, and a common concern and cause of death among young people being the fourth leading cause of death among people aged 15 to 19. And over 3/4 of suicide deaths do occur in low-income or middle-income countries. So for that background, just to set the scene for us, we should talk about if we have that many people globally with mental health conditions, are people seeking help? But often we find that actually there's a large gap in help seeking. Figures in Australia show that 1 in 2 people with a common mental illness do not seek any professional help in a 12-month period. And this can be for a variety of reasons. This could be that they may not be recognising themselves that they may have symptoms of that mental illness. It could be around cost or access to services. So in various parts of the globe, no doubt from where you might be joining from today, there's a lot of challenges with access and cost of mental health services. Even similarly in Australia, that can often be a problem. There can often also be a lot of stigma related to mental illness, and that can impact on people seeking help. Sometimes that can also be even the anticipation of stigma. So concern about if I raise this, if I talk about it, how people may judge me, how they may treat me poorly, perhaps. And that often leads to people not seeking help and not raising concerns. There can also be a fear of disclosure. So there can be concerns that if I put my hand up and say that I have some of these symptoms, who might get told about it? Will everyone know about it? Will they be talking about it? Will my workplace know? All of these type of things. So there can be a lot of concerns and reasons why people may not seek help, but there is a lot of opportunities for pharmacists to try and intervene to support help seeking. So due to pharmacists' trust and accessibility in their communities, I think we're uniquely positioned to recognise potential signs of psychological distress, particularly in primary care settings, but this could be in a variety of settings where a pharmacist may be working. And I think we have the opportunity to recognise some early warning signs, engage someone in a conversation, and think about how we can use that opportunity to try and triage and refer that person on to appropriate professional help. We've been doing some work in this area in Australia for a few years, and I think from my perspective, there's certainly a few particularly relevant population groups, I think, where pharmacists have a unique opportunity for, particularly in the area of perinatal women. So we know that there's increased rates during pregnancy and after birth of a baby, and often perinatal women will be seeking advice and support from pharmacists. And so it's a timely opportunity to ensure that they are getting screened and have the appropriate supports. Another possible group is also older people. We know that older people may also have multiple chronic illnesses. They may be experiencing polypharmacy, where they're taking multiple medications. And a few of those things can be risk factors for possibly developing depression. So they're particularly some of their subgroups, if you like, that we've been looking at in some of our work in this area. But it's important to note that we're not talking about diagnosing here, and I think that's a really important distinction, that pharmacists are not diagnosing a mental illness. It's not part of our scope of practice, but rather we are recognising some early signs and having a conversation and referring that person on to appropriate help. So the recognition of pharmacist roles, as we heard from Inez in the introduction, has really been growing. And these are some examples of some international documents previously. So previously in Australia, I was involved with a mental health care framework for pharmacists in Australia. The earlier FIP document in 2015 had a focus on mental health document. And also the UK have a No Health Without Mental Health, which is a nice framework around pharmacists, how pharmacy can support people with mental health problems. In the Australian framework, we specifically talk about the role for pharmacists in supporting early detection and intervention, which is quite timely for what we're going to talk about today. And also, as highlighted by Inez, and together with Hayley and other colleagues internationally, I was involved in helping to develop the Mental Health Care Handbook and Knowledge and Skills Guide. And these are great resources that do go through a range of topics related to tonight's webinar around how to recognise and refer people who may be experiencing depression or other mental health conditions. So I do recommend you have a look at these if you haven't yet already. Also, it has been a topical area in lots of the pharmacy kind of publications in recent years around this opportunity for pharmacists to intervene and save lives with depression screening. So these are a few, not ones I want you to necessarily read, just to highlight. These are a few articles from recent, a number of them from the US, which have really highlighted that this is an important area, but perhaps we need more studies, and I would agree with that. We need more studies to highlight the impact of pharmacist roles in depression screening. And in terms of some of the research, together with some colleagues in Australia, we've been doing some work in this space for a number of years. We've looked at a variety of aspects about whether or not it would be acceptable to different stakeholders. So particularly we've looked at, is it acceptable around women, perinatal women, for example, and we've recently explored their views about how would they feel about a pharmacist delivered service where they were screened as part of in a pharmacy setting. And most of them are very receptive to this and would appreciate that support. Similarly, we're also exploring this area in older adults and their views around whether or not it would be appropriate in the community pharmacy setting. And we're currently running a trial of older adults where we are screening older adults in community pharmacy in Australia. And a broader review by some Australian colleagues highlighted that pharmacists globally are capable of screening for depression, yet we really need larger studies with more kind of outcome data related to this. But I'll just highlight a little bit about one of our earlier studies. So the first kind of feasibility study of this space that we did nearly 10 years ago now was looking at community pharmacists performing depression screening. And in this study, a few kind of interesting takeaway points, I guess, from this study was that of all of the people that were screened as part of this study, 70% did lead to a referral on to another health professional for further follow-up. What was also interesting was that 25% of the consumers who were screened in the pharmacies were not known to the pharmacist. So they weren't always the regular patients in the pharmacy that we would have thought about. Sometimes they saw a poster up in the pharmacy and they approached the pharmacist themselves to say, oh, can I take part in this? This might be me. And some of the challenges and also enablers to a depression screening service that we looked at came out of this study was that consumers liked the accessibility of pharmacists, the private area, the awareness promotional campaign in the pharmacy certainly helped, so having those resources on display. But there were some challenges still around the stigma, making sure we're very aware of the privacy concerns. But there was certainly a bit of a lack of awareness of pharmacists' role in this space. And I think this was 10 years ago now, and I think we are starting to see a bit of a shift in that space. But we need to grow the awareness around consumers about the fact that pharmacists do have a role to play here in this space. So I just want to touch on that mental health promotion point as we are now talking about, as we are joining, well, certainly here in Australia, it's already World Mental Health Day. Participating in mental health promotional campaigns is a really important way to raise awareness amongst your community that pharmacists do have a role to play in supporting people with mental illness. And so having those resources on display, as I mentioned in our studies, has highlighted that it makes people see, oh, okay, I can talk to the pharmacist about my mental health concerns. It makes it feel more comfortable, approachable. So I really encourage you to have a look at the various resources that are available, either through the official World Mental Health Day website, and there are lots of national and local organisations that also have a lot of promotional materials. So I think that's the important first step. So then I think the next first step is to be familiar with the diagnostic criteria. So these are the diagnostic criteria for depression or major depression. And I won't go into all of these in detail. They're here for you to look at, but I think it's important to have these in the back of our mind, to be thinking about what types of things we might be noticing in someone that warrants us to approach them and have a conversation. So whether or not we've noticed the way that they might appear, so they're not looking after their appearance, perhaps weight loss, insomnia. So they're actually asking you about some of those concerns. Perhaps it's even just the way that their body language may appear. So there are a range of kind of signs that we might be able to notice. And here I've tried to summarise some of the ways that I think certainly in a community pharmacy setting, you might notice some changes about someone. It could be in a regular patient, but it could be the first time you have that encounter with someone too. So someone at risk of depression, they might start to show different body language. They might be more withdrawn, not engaging in as much eye contact as normal. Maybe they're not looking after their appearance as much as before. There could be any verbal communication. So there could be any spoken intention, perhaps I just can't cope anymore, or any language like that may raise concern. Often we also know a lot about a patient's history too. So we might know that they've had a recent diagnosis, perhaps of a chronic illness. Perhaps they have lost a loved one, so they're in bereavement. Or there's been a tragic experience. So we may know of a trigger that may be of a concern. And then sometimes it may be something directly that they're asking us about in the pharmacy. So they might be asking specifically for some herbal products, perhaps to help with energy or sleep or stress or different things like that. Sometimes antihistamines, certainly in Australia, some of the drowsy antihistamines get requested for that type of thing, for kind of sleep. Sometimes people might also be requesting analgesics for chronic aches or pains, and sometimes ongoing kind of chronic aches or pains that don't have a specific cause. That also could be another flag that perhaps there's an underlying risk of depression. And it could be symptom-based requests relating to those things, because as we know, depression can affect our body physically in many different ways. So there can be a lot of different possible signs for us to look out for. So then we want to think about how we can approach a conversation about this. And it's important to keep in mind a few things when we have these conversations, because they can be sensitive and difficult conversations sometimes to have. So we want to make sure that we're not expressing any judgment about the situation, accept the person as they are. Think about our listening skills. Think about making sure that we're not interrupting them, trying to pay attention to what they are telling us. Check that we've understood what they're saying and paraphrase that back to them to make sure we understand what might be going on for them. And then it's also really important to think about our body language. That can play a big part of a conversation like this. So showing that you're attentive to them, keeping eye contact comfortable, so not staring at somebody, and sometimes by sitting next side by side next to somebody, that can help someone kind of look away from you or engage in eye contact if they feel comfortable. So just some kind of thinking practically about our body language can help these conversations. So then we want to think about how we approach a conversation. We might need to think about the time and the place. Is it really busy in the pharmacy? Do I have a chance to have this conversation? How can I respect their privacy and confidentiality, depending on where you are? Do you have a space, a private consultation room, or somewhere where we can have the conversation? Is the patient ready to talk? Do we think that they realise that perhaps something might be going on? Thinking about those communication skills and really just trying to engage them in a conversation about how they're feeling. Maybe tell them why you're concerned about what you've observed. So, look, I've noticed that you seem a bit upset, or I've noticed that XYZ, whatever it might have been that you noticed. And we need to think about what cultural values or beliefs that person might have, any language barriers, and any potential stigma as well. So all of those considerations to take into account. So screening tools can certainly be used to give us a quick kind of indication of whether a further assessment or referral is warranted. It might help confirm our suspicions and support a conversation. So it's a useful way to have a structured approach to a conversation. There are a wide range of screening tools that are available. And really, effectiveness of screening does depend on the screening tool used. So it is important to use a tool that is reliable and valid, so that we ensure that we're using something that is appropriate. They can vary in length, in style, in presentation. Some of them can be done individually by the consumer. Some of them might be by the health professional, for example, themselves. So there's a range of different tools available. So I'll just give a couple of examples of a few suggested ones. A really common one for depression is called the Patient Health Questionnaire 9, PHQ-9. We did a systematic review a few years ago looking at the psychometric properties of screening tools for use in primary care. And this was the one that we recommended as part of that review. Sorry, we've just skipped forward. Because of its good psychometric properties. So this is the 9 items here for you to have a look at, but basically it's fairly straightforward and ask people over the last 2 weeks, have you had any of these symptoms, and it gives an overall score, and there is a guidance on what to do with that score. So that's probably the most one I would recommend. There's also a brief version of PHQ-2, which has just a brief 2-item screener, which can be used if you want something very quick to guide a conversation. Another common one that is sometimes used is the Kessler scale, or the Kessler 10. This is commonly used in Australia. This is a link to an Australian website called Beyond Blue. It does cover symptoms related to anxiety and depression, so it's more of a psychological distress kind of score, but it can also be a useful one to get a sense of how well someone is doing, and ask about a variety of things over the past 4 weeks. And more recently, we've been using the geriatric depression scale in a trial of older adults. So this is specifically related to people who are older adults, and it gives a score of these 15 items, which can suggest mild to moderate depression or severe kind of depressive symptoms. So using these can be a helpful way to guide a referral to a healthcare professional. So they're a useful tool. There are many others to consider as well. This is just a couple of examples. So in summary from me, and then I will hand back. Pharmacists are certainly well trusted. Consumers do seek our advice and support. So we really do have an opportunity to recognise the early signs and symptoms of depression, refer on appropriately. We do need larger scale trials to demonstrate the benefits of pharmacist-delivered depression screening models. So at the moment, there's lots of pockets of some small data. And certainly depression screening tools can be incorporated into pharmacy-based models of care, either as a standalone service or they could be incorporated into broader, more comprehensive pharmacy services as well. So I'll leave it there, and I will, oh, sorry, I also had sorry, those were on the wrong order. I also had a summary about some communication tips. Apologies about that. A couple of things just to take home messages about your communication and making sure you keep these in mind. And that we empathise with the distress that someone might be going through if they may be at the early stages of a mental disorder. They need our support and empathy. Okay, thanks, Inez.
Thank you so much, Claire, for your brilliant presentation and for showing us some screening tools available to assess for depression, and also for these tips for communication. I would also like to mention that pharmacists watching this webinar will find the link to some of these screening tools in the handbook. So I invite you to download the handbook and to read the handbook and the intervention. If you have any questions for Dr. Claire, please leave them in the Q&A box. So our next speaker is Dr. Haley Gorton. Dr. Haley is a senior lecturer in pharmacy practice with a background in community pharmacy. Her research predominantly focuses on pharmacists' role in mental health care, including suicide prevention. She is a Churchill Fellow and the co-chair of the International Association for Suicide Prevention, Special Interest Group in Mental Health. Thank you very much, Dr. Claire, and the floor is yours.
Thank you, Inez and Claire and everybody joining today. It's wonderful to see so many of you here ahead of World Mental Health Day. And it's my pleasure to be talking about what we might be doing in pharmacy for referral pathways. So a couple of declarations of interest. The mental health handbook that you've seen, and Claire mentioned that we were both co-authors on that. So hopefully that will provide me with some insight, really, more so than a conflict. And I also co-chair the International Association for Suicide Prevention, a special interest group for suicide prevention in primary care. So a little spoiler to start, I probably don't have the full answers about the role of pharmacy teams and referrals, but what I thought I would share is how referral pathways have been a recurrent theme in our work. So most of the work that I've been involved in has been related to the pharmacy team's role in suicide prevention, but I have also done some work on different types of mental health support. My practice background is from community pharmacist rather than specialist mental health. Hopefully that will be helpful in some sense, because I believe we have a role in whatever sector we are working in, but you'll see most of the research is related to community pharmacy, as per the studies that Claire also spoke about. And we're very much thinking about where pharmacists and their teams might triage people to. But actually, as pharmacy role expands, so in the UK, there's a big expansion of pharmacists working in general practice, family doctor surgeries. There is actually scope that some of this referral could end up going two ways. So an important time, I think. So probably don't need to tell the 600 of you join the webinar today that the pharmacy profession is committed to mental health. But just to reiterate, the FIP Mental Health Care Handbook that was published last summer, where the role in triage and referral was highlighted, and examples related to collaborative care were also provided. And I think that fits into this theme of thinking about referring and triaging people. As I said, much of our work so far has been on suicide prevention. And for those of you who perhaps are a bit newer to this field, you may not have seen this diagram before. This is lifted from the World Health Organization Live Life Guidance. You've already heard this mentioned once because it's on one of the questions we had earlier. But essentially, this is their summary of where they think nations actually should focus their efforts with suicide prevention strategies. And the LIFE acronym is a series of the effective evidence-based interventions that they found. And I think this helps us to think where pharmacists might fit in this role. So on the E, we can see there's a role in early identifying and supporting people who are affected. So this is what we've referred to in guidance as the social, holistic and clinical role of pharmacy teams. So talking to people, having conversations, and actually that could include that triage role. And then if we think about the L, which we'll be talking about less today because of the focus of this presentation, but there is a role in limited access to means of suicide, so particularly medicines. We have seen examples in our studies of pharmacists supplying pesticides, or also that the people have access to sharp implements from pharmacies too. So I thought I would talk about this role of referral across a couple of the studies that we've done. So one of the studies, it was an interview study of 25 staff working in community pharmacies in the northwest of England. That was conducted in 2018. And we also have published a cross-sectional survey of pharmacy staff again, which was predominantly completed by pharmacists and pharmacy technicians, where they described their experience and attitudes towards suicide prevention in pharmacy, and talked about what they have done in the past and their experiences, perhaps concerns. Now you'll see obviously two different studies, similar populations, but you'll see now how we had some parallels in talking about referrals. So in that interview study, pharmacy teams talked about how they were unsure about how people should be referred and how. So they heavily relied on signposting to the GP, so the family doctor, and sometimes facilitated that referral, sort of saying to the GP, I want you to see this person for whatever reason. There were some examples where they tried to involve the family and work with the family, and also when they might have suggested charity with support resources. But sort of the overall message was that pharmacy staff really calls for a well-defined and direct referral system. The theme of triage and referral also came up in the cross-sectional survey. And I'll let you just read this quote. So this pharmacist was concerned that a patient was suicidal and wanted to liaise with the GP and get them involved in the person's care. But unfortunately, they had quite a bad experience when they went to the GP, went and asked for this help from the GP, who perhaps sort of said that they were a little bit inconvenienced. So this goes back to sort of making sure we've got those working relationships and other healthcare professionals understanding our role within this. This pharmacist also talks about speaking to adult safeguarding teams, so they're running local areas where they have a responsibility for any safeguarding problems. So those were the sort of big studies really that talked about triage and referral. We've also done some work about understanding how pharmacy students might want to be involved in things like mental health first aid. And in one of these studies, they sort of unprompted, it wasn't specifically about referrals. They gave us quite a lot of comments and we themed them. And one of the themes that came out was related to referral. So they were saying that pharmacists have a unique opportunity to build a rapport, thinking about signposting, so beyond the GP here, thinking about talking therapies, psychological interventions, for example. And they did ask for perhaps some more training on where they might refer people within a community. So this prompted some work to think about, well, what resources might pharmacists and their students use? And this was, you can see the resource at the bottom. It was led by some of my wonderful pharmacy students. They did an online survey in 2022 to understand this, and there were only a few pharmacists that responded. It was majority of pharmacy students, but most, you know, a third had never used any sort of support resources to work with patients. Overall, 20% felt prepared, and actually there was no difference between pharmacists and pharmacy students. So that's perhaps quite telling. And they really wanted some training, 91%. So we want to know how to use these resources effectively to support people. And when we asked them which mental health problems or conditions you might see in community and use resources for, you won't be surprised probably that they picked out the most common mental health problems of anxiety and depression. But there was some recognition from other mental health problems too. And you'll see following anxiety and depression, actually did pick out the need to support people with eating disorders. And that's probably something as a profession we haven't touched on as much now. There's been, you know, occasional mandates from different pharmacy support organisations to encourage pharmacists to be involved in the care of people with eating disorders. But we perhaps don't know that much about that. So that's an interesting one. We also asked our pharmacy students what they knew about some of the particular charities in the UK that might support mental health. And the graph is sort of showing their different responses, but you'll see on the middle column, sorry, no, the second column about what they'd heard of, the light blue is Samaritans. So Samaritans is probably the best known mental health charity in the UK. But if you look at the light blue on the left-hand side, I've never heard of, there are still quite a few students that had not heard of Samaritans. A really, really common mental health charity. Not everybody had heard of them. So I think we've got some work to do in ensuring pharmacy students know where they might signpost to. And some of the charities were quite poorly heard of. We did a brief pilot in community pharmacy where we were supporting people if they were newly prescribed or changed an antidepressant dose or drug or form. And the snippet from the table I've got here shows how pharmacists thought about referring people. So they talked about signposting to mental health charities sometimes, but they also looked at signposting to non-mental health charities. And I think this is key. And Claire alluded to this when she was talking about potential signs to watch out for. That in pharmacy, we sometimes have a pretty good idea of what's going on in someone's life, not just about their health. And there might be other factors that might be affecting their mental well-being. So some of the examples in this study, pharmacists referred to things like job centres, to citizens' advice and things. And when the pharmacists in the pilot were looking at their support resources they could offer people, they did it almost from what I call a micro local level. They were looking at things that are very close by to see where they might be able to refer their patients to. And this sort of prompted the current phase of work that we're doing, which is trying to look at streamlining some support and referral, because at the moment, pharmacists do tend to carry some sort of signposting handbook of different support resources, not just for mental health, but beyond. But actually, it's quite difficult to see, might be quite difficult, it might take you a bit of work to see what's really close by. So we've been working with a charity called Hub of Hope. Well, the charity is called Chasing the Stigma, and their platform is called a Hub of Hope. And it's essentially a catalogue where you can put a postcode in, or a zip code you might know it as, and it will tell you what resources are close by to you, which charities are close by, for example. And what we're trying to do is maximise coverage, or at least map the coverage in areas that are close to pharmacies, so they can be used as a resource. And this is an ongoing project supported by the University of Huddersfield Collaborative Venture Fund. The link I can put the link in the chat afterwards, because I don't think I can have access to show you right now. But just to give you an example, and this is credit to my wonderful colleague Shaquille, who if he's put different pharmacy postcode in, and you could see within 1 kilometre of a pharmacy what different support resources were available. So if we look at this purple one, Aston Pharmacy, within 1 kilometre of the pharmacy, they had a women's support resource. If we look on the other side, the Well Pharmacy, you see there's 4 different colour blocks. And if you look at the key, you'll see there's one for young person support, and so on and so forth for different types of support, so that people working in that pharmacy could then look at that and think, oh, well, that's what we've got close by. We haven't tested this yet. This is our sort of next stage, but it's what we've got in the pipeline. So pharmacy teams, do want to have appropriate referral and triage routes into other health and social care organisations, providers and third sector organisations, both mental health specific, and also to support with all those societal and personal things that might influence one's mental health. In the UK, in England, we're expecting the new medicines service, where we support people with certain new medicines to be expanded to include antidepressants. It was supposed to start earlier in the year, but there's been a bit of a delay. I think that might be a real foot in for pharmacists to have some of these conversations and needing to know where they might want to provide extra support for people, because they need to know what's local, and they can't be expected to know all these things off the top of their head or updated things. And as I said before, some mental health specific, but also some societal. So that's a little whistle-stop tour of where referral keeps coming up as a theme across different aspects of our work. And I'm very happy to take questions now or in the panel at the end. Thank you.
Thank you very much, Dr. Haley, for letting us know about the role of pharmacy teams in suicide prevention and how can pharmacists could referral patients. I want also to tell to our participants on this webinar that you can find a chapter on suicide prevention and medication-related means restrictions for suicide risk mitigation on the handbook. So once again, if you have any questions for Dr. Haley, please leave them in the Q&A box. Our last speaker is Dr. Sheila Ferreira. Dr. Sheila is a pharmacist who graduated from the Federal University of Espírito Santo and has a PhD in clinical pharmacy mental health from the Federal University of Ceará. She has been working in the field of mental health since 2015, with experience in pharmacotherapeutic monitoring of patients with depression and anxiety disorders. Thank you very much, Dr. Sheila, and the floor is yours.
Olá. Primeiramente, gostaria de agradecer, a todos pela oportunidade de estar aqui representando aí um trabalho que eu considero muito importante, no nosso país, e espero que a nossa apresentação seja bastante promissora. Podemos começar, por favor. Eu havia combinado com vocês que vocês iriam passar, não é isso? Isso, muito obrigada. Bom, como foi falado desde a primeira palestra, neste evento, os transtornos mentais, eles vêm nos últimos anos aumentando consideravelmente. Em 2019, a Organização Mundial da Saúde estimou que cerca de 1 a cada 8 pessoas no mundo apresentavam diagnóstico de transtorno mental, sendo a prevalência maior de transtornos da ansiedade, seguido dos transtornos da depressão. E dentro desse contexto, os farmacêuticos, eles vêm sendo chamados, há alguns anos, a participarem, a atuarem na área da saúde mental. Nós temos aí na literatura várias evidências de que a participação do farmacêutico na saúde mental, ela gera desfechos positivos. Então, o cuidado em saúde mental, que é aquela questão do farmacêutico não só estar presente tecnicamente na logística do medicamento, na entrega, na dispensação do medicamento, como também centrado no paciente, desenvolvendo não só as habilidades técnicas, como também as habilidades de comunicação, de escutativa, né? E em termos de Brasil, assim como aconteceu no mundo, né, em termos mundiais, nós temos um grande aumento nos últimos anos dos transtornos de ansiedade. O Brasil, desde 2017, ele é um país líder mundialmente no diagnóstico de transtorno da ansiedade. Cerca de 1 em cada 10 brasileiros apresentam este transtorno, e nós já somos líder também, infelizmente, no diagnóstico de depressão na América Latina. Somos o 5º em termos mundiais. E com isso, há uma necessidade, uma demanda muito grande da ação dos farmacêuticos na saúde mental no Brasil. Infelizmente, hoje, nós ainda não temos uma obrigatoriedade da participação dos farmacêuticos na rede de saúde mental brasileira. Né? Ainda falta uma padronização do processo de trabalho, ainda há um campo aí muito longo a ser conquistado aqui no nosso país. Pode passar, por favor. Assim, falou isso. Com isso, hoje eu trago aqui para vocês um exemplo prático, né, que foi o estudo do meu doutorado, foi um trabalho que foi realizado no CAPS. O que são os CAPS? Eles são Centros de Atenção Psicossociais Brasileiros. O CAPS é a principal unidade de saúde ambulatorial que recebe os pacientes com transtornos psiquiátricos. Faz parte da rede de atenção à saúde brasileira, faz parte do Sistema Único Brasileiro, do SUS, então é um serviço gratuito, tá, aos pacientes portadores de transtornos psiquiátricos. Nós fizemos, durante 2 anos, um estudo controlado, randomizado, e, além da análise quantitativa deste estudo, nós fizemos também uma parte qualitativa, que eu vou mostrar aqui para vocês, que foi conduzido com os pacientes que receberam o acompanhamento, a intervenção farmacêutica, ok? Podemos seguir, por favor. Bom, aqui eu mostro um esboço, um resumido para vocês. Aqui eu tenho o grupo intervenção, no qual os pacientes com diagnóstico de depressão ou transtornos de ansiedade foram submetidos a um acompanhamento farmacoterapêutico por 4 meses. Então, eu os acompanhava, né, uma vez ao mês. Eles passavam pela consulta psiquiátrica e depois passavam por uma pós-consulta farmacêutica. Nesta pós-consulta, nós identificávamos, né, indicadores clínicos como índice de adesão ao tratamento, escalas validadas de depressão e ansiedade, identificávamos possíveis problemas relacionados ao uso dos medicamentos. Além disso, nós aplicávamos instrumentos, né, indicadores humanísticos, como o Referral 5D3L, tá? Para medir a qualidade de vida destes pacientes. Indicadores de processo também estiveram presentes, como o número de intervenções farmacêuticas. Estabelecemos um plano de cuidado a estes pacientes, e ao final dos 4 encontros, eram realizadas 2 perguntas a estes pacientes, e essas perguntas foram transcritas, né, analisadas e categorizadas de acordo com a análise de Bardhan. Nós tínhamos concomitantemente um grupo controle, no qual havia aplicação de medidas, né, de parâmetros clínicos, humanísticos, mas não havia a intervenção farmacêutica, não havia o acompanhamento farmacoterapêutico que era realizado neste grupo através do método DADER. E, adicionalmente, alguns pacientes que participaram do grupo controle foram randomizados, né, aleatorizados novamente, e tiveram a oportunidade de participar do grupo intervenção por mais 4 meses de segmento farmacoterapêutico, e nós chamamos este grupo aí de grupo intervenção pós-controle, ok? Podemos seguir, por favor. Aqui eu mostro um primeiro resultado, um aspecto quantitativo do nosso trabalho, que foi um aumento significativo da adesão ao tratamento medicamentoso por estes pacientes que receberam o acompanhamento farmacoterapêutico. Então, nós observamos aqui, ó, que já na consulta 3, nós já tínhamos aqui significativamente um número maior de pacientes com alta adesão ao tratamento, né? O que foi corroborado aqui na consulta 4. Não está mostrando aqui nesse slide, mas nós tivemos também naquele grupo intervenção pós-controle uma melhora nos índices de depressão também, tá? Deste grupo de pacientes que foram submetidos ao acompanhamento farmacoterapêutico. Então, a gente mostra aqui, né, realmente o farmacêutico, né, efetivando aí, né, a sua contribuição ao acompanhar o plano terapêutico do paciente. Podemos seguir, por favor. Em relação à análise qualitativa, tanto os pacientes quanto a equipe de saúde do CAPS, porque o CAPS está dentro de um contexto multidisciplinar, então, nós ofertamos um serviço ali, nós tínhamos ao nosso lado psicólogo, psiquiatra, terapeuta ocupacional, assistente social, enfermagem. Então, ao final do segmento farmacoterapêutico, nós fazíamos a pergunta tanto aos pacientes que haviam participado do grupo de intervenção, quanto à equipe de saúde. E essa primeira pergunta era: o que você achou deste serviço ofertado no CAPS? Porque antes esse serviço ele não acontecia no CAPS, só acontecia o serviço da entrega do medicamento, mas aquele cuidado centrado no paciente, ele passou a surgir com o nosso trabalho. Então, este esquema, essa figura mostra, né, sob a análise de Bardan, as categorias que surgiram deste acompanhamento, né? O que tanto a equipe de saúde quanto os pacientes acharam do acompanhamento feito pelo farmacêutico. E aqui nós podemos ver que foi muito positivo. Sobre a percepção dos pacientes, o acompanhamento, o serviço gerou sentimentos positivos, como satisfação, gratidão, desejo de ter o serviço no CAPS, motivação, felicidade, amor, transformação de conhecimento e bem-estar. Então, como os próprios outros palestrantes falaram, aqui muito bem informado por sinal, não é só mais a capacidade técnica, mas aquela criação de um vínculo terapêutico, né? Aquela diminuição do estigma com o paciente portador de transtorno psiquiátrico, ele é muito importante. Além disso, nosso serviço gerou reconhecimento profissional, foi caracterizado por confiança e confidencialidade, o que mais uma vez ratifica aí que diminuiu o estigma, estreitou o vínculo terapêutico, né? Para muitos pacientes foi um primeiro contato, eles não tinham tido contato com esse cuidado farmacêutico na área da saúde mental. A equipe de saúde multidisciplinar considerou que o nosso serviço promoveu uma qualidade nas relações interpessoais, ou seja, muitos pacientes demonstraram que falavam para o farmacêutico que não tinham coragem de falar para outros profissionais da área da saúde. Então, isso foi muito importante, um resultado muito importante do trabalho. E ambos, tanto a equipe de saúde quanto os pacientes, consideraram o serviço de acompanhamento no CAPS essencial, porque veio de encontro, né, às demandas dos pacientes que tinham dificuldade de compreender como era o seu tratamento, que usavam sobredose, ou seja, o acompanhamento ajudou a racionalizar a terapia medicamentosa, né, ajudou no manejo de reações adversas e de efeitos adversos, ajudou na elaboração de um plano de cuidado específico a cada condição de cada paciente. Além disso, o serviço, além de ser importante porque foi essencial, ele impactou nos desfechos dos pacientes, né? Os pacientes tiveram uma autopercepção de melhora clínica e econômica, aumentou o conhecimento desses pacientes em relação à terapia e promoveu mudanças comportamentais. Vários pacientes passaram a adotar estratégias não farmacológicas, como prática de atividade física, adesão à terapia psicológica, né? Antes eles não aderiam a essas estratégias e passaram a aderir, passaram a mudar o seu comportamento após o acompanhamento farmacoterapêutico. Além disso, foi muito importante esse serviço, porque permitiu a identificação dos atributos do farmacêutico. E esses atributos foram o aconselhamento, confirmando aí todos os sentimentos positivos e a confiança e a confidencialidade presentes neste acompanhamento. E, além disso, um atributo muito importante foi o manejo da adesão, né? O que vem ao encontro, né, daquele resultado que eu mostrei, que nós realmente conseguimos melhorar a adesão de todos os participantes do nosso estudo, ok? Podemos. Além da pergunta, o que vocês acharam do serviço, uma segunda pergunta muito importante, feita tanto para os participantes do estudo, quanto para a equipe de saúde do CAPES, foi: o que você conhece do farmacêutico na saúde mental? E essa figura nos mostra pontos muito interessantes, como, por exemplo, a equipe de saúde, antes da provisão do serviço, não reconhecia o perfil clínico do farmacêutico, só reconhecia o farmacêutico com aptidão técnica, focado na logística e apenas para cumprir a obrigatoriedade da presença técnica no CAPS. E após o serviço, esse reconhecimento ele passou a ser estabelecido, né? O profissional farmacêutico ele passou a ser reconhecido pela equipe de saúde como um profissional não só de logística, mas também de cuidado centrado no paciente, essencial. E, inclusive, essa equipe ela sugeriu um foco, né, do farmacêutico mais para o paciente e uma expansão do cenário de prática, né, corroborando aí o que a gente já vinha falando há muitos anos, né, que só gera desfecho positivo nessa transição, não só da logística, né, do dar o medicamento, do oferecer o medicamento, mas com também, né, aquela gestão clínica, né, do medicamento centrado no paciente. Bom, os pacientes, por sua vez, mostravam diferentes níveis de conhecimento da ação do farmacêutico na saúde mental. Alguns tinham prévio conhecimento, mas muitos não tinham conhecimento do farmacêutico nessa área, né? E após o serviço, assim como a equipe de saúde, né, eles passaram a enxergar o profissional farmacêutico focado não só na logística, como também centrado no paciente, no cuidado do paciente, né? E ambos, tanto a equipe de saúde quanto os pacientes, reconheceram as obrigações dos farmacêuticos, né? Que coincidem com os atributos mostrados na figura anterior, que são aconselhamento do paciente. Então, o aconselhamento ele foi algo que foi bastante reconhecido após a provisão deste serviço, suporte à equipe, né? Então, reconhecimento de que dentro de um contexto multidisciplinar, o farmacêutico ele é essencial, né? Tanto no acompanhamento, quanto não só com as aptidões técnicas, mas também com as aptidões do cuidado, né? Centrado no paciente. Podemos seguir. Com isso, nosso trabalho foi um serviço importante em termos de Brasil, em termos de unidade ambulatorial de pacientes psiquiátricos, porque pôde promover o reconhecimento profissional do profissional farmacêutico, gerou sentimentos positivos nos pacientes que foram submetidos ao acompanhamento, permitiu a identificação de atributos profissionais desconhecidos, como aconselhamento, né, os serviços sendo essencial, o manejo da adesão medicamentosa, né? Apesar disso, ainda houve uma dualidade entre os atributos logísticos e clínicos, porque ainda havia um desconhecimento muito grande da parte clínica do farmacêutico na saúde mental. Contudo, pela primeira vez, os componentes de um processo de trabalho clínico do farmacêutico para pacientes ambulatoriais psiquiátricos foram identificados. Podemos seguir, por favor. Bom, então o estudo mostra que esse acompanhamento farmacoterapêutico num curto período de tempo, que no nosso caso foram 4 meses, uma vez ao mês, melhorou o nível de adesão, né, ao tratamento, que é um aspecto clínico, além de ter melhorado os índices de depressão no grupo GIPC, de pacientes com depressão e ou transtornos de ansiedade. E também definiu componentes mínimos e aspectos estruturais para promover este serviço no CAPS. Esse estudo reforça a necessidade de estabilizar outros estudos de controle, né, de caso controle, com maior tempo, né, além dos 4 meses, mas foi um trabalho pioneiro, estabelecendo critérios de processo de trabalho oferecido para os pacientes psiquiátricos ambulatoriais, tanto no cenário de prática, né, quanto no cenário da pesquisa. Podemos. Bom, com isso eu agradeço mais uma vez a participação, estou aberta a perguntas, aqui estão os meus contatos, e foi um prazer estar aqui com todos vocês. Muito obrigada.
Thank you, Dr. Sheila, for showing us such an interesting example from Brazil. So we will now move on to our panel discussion. So please open your camera. Dr. Claire and Dr. Ailey. Thank you so much. And if you have any question, please use the Q&A to add your questions to our panelists. Gonçalo, please go back in the slide. So we have some questions on the Q&A. Some of them are already being addressed by our panelists. We have some more if you want to type. But I have one first question for all of you. Do you think pharmacists are aware of the importance of mental health? I don't know if Claire wants to start.
Sure. Thanks, Inez. Look, I do think, certainly from my perspective in Australia, I think there's been an increasing recognition and interest of pharmacists in wanting to be involved in mental health care in recent years. I think there's also a growing recognition from the public around pharmacists' contribution to this space as well. But I still think we've got a fair way to go. I think there's a lot of pharmacists interested, but even just by some of the questions in the chat, I think we need to make sure that pharmacists are appropriately trained and supported to have roles in mental health care as well, and to better, educate the community about being able to access those supports. But Hayley and Sheila may like to add to that.
I think that was wonderfully said, Claire. The only additional bit I would say is that sometimes we may hear things that upset or distress us as well as pharmacists. So something we're not particularly good at in pharmacy is having those support systems for ourselves and our colleagues. And that's something I'd like to see more for, not just for this, but for lots of different things that we do in pharmacy. And obviously that also applies to people on the call today. And what I was going to do was put in the chat one of the international resources of where you can find different helplines, as that might be helpful on an international call. The other thing I was going to say is that the work, Claire, I think you mentioned that 3/4 of suicides are in low middle income countries, and that's probably doesn't match the work that we presented. So it's important to encourage our colleagues internationally, if they're able to get involved in work across the globe, that's really important.
Thank you so much. I don't know if Dr. Sheila wants to add something. And for example, in Brazil specifically, the pharmacists are aware of the importance of mental health in general.
Acredito que nos últimos anos melhorou bastante, né? A gente teve em 2015, de 2015 para cá, né? A FIP lançou a primeira cartilha, né? Chamando os farmacêuticos em 2015 para atuarem na saúde mental, e a gente observa que de lá para cá, principalmente após a pandemia, nós tivemos um maior interesse, né, dos farmacêuticos na saúde mental. Contudo, eu acredito ainda que a gente tem um campo muito aberto, principalmente porque em muitos países, né, eu digo em termos de Brasil, nós temos muito desconhecimento ainda da área. E eu acredito que o desconhecimento gere um pouco de temor por parte dos profissionais de agirem. Então, por isso que a psicoeducação, falar do assunto, como nós estamos fazendo aqui hoje, né, eu acho que acredito ser muito importante para que a gente possa chamar mais profissionais da área. E aproveitando para responder uma única pergunta aqui do chat que eu visualizei, no CAPS, no Brasil, os farmacêuticos dispensam medicamentos, sim, tá? Mas a obrigatoriedade do farmacêutico dentro do CAPS, ela está atrelada à presença de uma farmácia, né? Então, a questão logística, tá? Não há ainda, infelizmente, uma obrigatoriedade, um incentivo do farmacêutico além da dispensação, tá? Mas na dispensação, nas unidades que tenham farmácia, tem que ter um farmacêutico, ok? Obrigada mais uma vez.
Thank you so much, Dr. Sheila. I have another question for you. What do you think are the main barriers pharmacists face when trying to implement a pharmaceutical care program like the one in Brazil? And also, how can these barriers be overcome? And if you have some advice to give to pharmacists listening to us who are interested in implementing a similar program in their communities.
Eu daria um conselho para que os escutem, né, bastante a área, que é uma área linda. Eu sou apaixonada pelo que eu faço e é uma área que tem muita demanda, né? Eu acredito que, assim, se nós estudarmos, se nós tivermos a coragem de mostrar os resultados, né? Mostrem resultados. Muitas vezes as pessoas, os farmacêuticos, eles questionam, não, mas a equipe multidisciplinar não aceita as nossas intervenções. Mas isso é só no início. A partir do momento em que a gente estuda, em que a gente começa a fazer a diferença na vida do paciente, não só na questão logística, mas na questão mesmo comportamental, na questão econômica, né? Na questão da qualidade de vida desse paciente, nós teremos respaldo, nós teremos respeito para atuar cada vez mais na área e contribuir aí nessa área tão linda que necessita tanto da gente.
Thank you so much, Sheila. I don't know if Claire or Ailey want to add something. What are the main barriers to implement this kind of services, not only pharmaceutical care in itself, but also the screening part and also the referral?
Just Inez, I guess from my perspective in trying to run a few trials of depression screening programs in pharmacy so far, it is challenging. I think firstly, in a research context, it's been hard because there's a lot of stigma, as I flagged, and sometimes getting the patient to be willing to participate when it's a trial can be an added challenge to if this was a ordinary service. But I think what it's highlighted to me is perhaps that some of these type of screening interventions may be better incorporated into a already existing kind of service. So like Hayley's talked about, maybe in the UK, a new medicine service, or in Australia, we have MedScheck or medicine use reviews, where these type of screening tools might become more commonplace as part of a existing program. That's one thing, just because sometimes I think that overcomes the challenge of raising the concern that, I as the pharmacist am concerned about your mental health, and I think you may be at risk of mental health. And sometimes perhaps engaging in that initial conversation can be a little bit challenging in the community pharmacy environment. And if it becomes a bit more of part of a routine kind of service, then that perhaps may overcome that. But there's also lots of other barriers in it that we still need to work on around how we fit into the primary care system, the referral pathways, some of that stuff that Hayley talked about, linking people into the right supports. Still a number of challenges, but I'll stop there.
Do you want to add something?
I suppose also just acknowledging people's confidence to have the conversations, which sometimes they perhaps don't want to say something because they don't want to go, if the answer's yes, I need some help, they want to make sure they know, the pharmacist wants to make sure they know what they do next. So it's having all these different steps in place and encouraging pharmacists to say it's okay to ask some of these difficult questions, but also thinking about what you'll do in that next step.
Thank you so much, Ellie. So we have lots of questions in the Q&A box, but importantly, we don't have the time to address all of them. But I have one big topic that I want to mention, and also I want to help the pharmacists with this topic, and I want your advice on this. So what I want to mention is not only it is important for pharmacists to address the mental health concerns of their patients, but it is equally important that they consider their own mental health and that of their pharmacist, and also that of their pharmacist colleagues. The issue of mental health and burnout among the pharmacy teams has become more widely recognized in the recent years, and mainly during the COVID-19 pandemic. And also, according to the WHO, burnout is an occupational phenomenon that is caused as a result of chronic stress in the workplace, and is usually characterized by symptoms such as feelings of energy depletion, increase of mental distance from one job, or feelings or negativism related to one's job, and also reduce professional efficacy. So with this in mind, for all of you, the question is, what are some strategies that can be used to prevent and manage burnout in pharmacy teams? Do you have some advice for the people listening this webinar? Claire, you can go.
Yeah, sure. I'm happy to start, Inez. Look, I think it's a really important one, and I think it's a really nice one that we finish up with on World Mental Health Day. As pharmacists, firstly, we need to look after our own mental health and well-being before we can help other people. So I think that's a really important message that I think we should share, be looking out for each other. I think, look, there are various resources. In Australia, we're very lucky, and I think there's a similar service in the UK where we have a great charity called the Pharmacist Support Service, which is a volunteer service where any pharmacist can ring up at any time, talk to an anonymous kind of volunteer to talk through any kind of stressful situations, etc., that they might be having. So I think trying to get those type of services available in various countries, I think is really helpful. That's a peer-to-peer, so you call in a fellow pharmacist to kind of debrief in a way, which I think is really important. I think the other, just I guess a few tips to think about, recognizing, I guess, some of these signs in our peers, in our friends, our co-workers, our colleagues, our friends, being willing to have that conversation and ask if they're okay. Obviously, there's been lots of challenges for health professionals like pharmacists during COVID and managing those workloads. But I think if we think about World Mental Health Day, trying to reach out to one of our colleagues and ask if they're okay is a good starting point, I think.
Thank you so much, Claire. Dr. Shelley, do you want to give some advice, some strategies?
Sim, acredito que a gente precisa cuidar de quem cuida, né? Como você bem explicou, né? Cuidar dos cuidadores. Para a gente cuidar de outros, a gente precisa estar bem enquanto cuidador também, enquanto profissional da saúde. É um grande desafio hoje em dia, né? Com a tecnologia, é muito bom, mas a gente tem que também dar paradas, né? Para meditação, para autorreflexão, para descanso. Eu acredito que hoje a gente tem que fazer esses tempos definidos de tecnologia, né? Cuidar do sono, principalmente da alimentação, prática de estratégias não farmacológicas, né, como prática de atividade física, adesão à terapia psicológica. Então, eu acredito que tudo isso seja muito importante. E comunicação, né? Saber, né, se comunicar com os outros colegas, formar uma rede de apoio, ter uma rede de apoio, como a doutora Welly bem falou, nós somos privilegiados por ter a FIP aí, apoiando essa questão da saúde mental, tendo essa sensibilidade desde 2015, né, com o lançamento da cartilha. Então, é isso. Acredito que seja isso. Obrigada.
Thank you. So, To finish and wrap up the webinar, Dr. Ellie, can you give us one last advice, one take-home message, please?
Oh, no pressure then. I think from what both Sheila and Claire have said is to recognise that as pharmacists or anyone working in pharmacy, we are exposed to the same potential mental health challenges as other people, and that mental health can affect everybody. And quite often what's said, particularly about suicide prevention, is that it's everybody's business. So hopefully people will take that away for mental health more broadly, that we can hopefully all have a role and all recognise our own mental health too.
Thank you so much. So we move on to the full time again to finalize our webinar. And please, Ellie, can you, yes, thank you, Gonçalo. So which of the following in relation to the global prevalence is incorrect? Incorrect. A, suicide is the leading cause of death globally among people aged 15 to 19. B, prevalence estimates of anxiety and depression increased by more than 25% in 2020. C, more than 75% of suicide deaths globally occur in lower or middle income countries. Or D, 917 million people globally live with a mental illness. You can respond right now. Remember, is incorrect. We are still receiving. Ten more seconds, and we will need to close this tool. Thank you so much. The second question is, which of the following is not a key pillar of the WHO suicide prevention live life framework? A, limiting access to means. B, interacting with media on responsible reporting. C, avoiding engaging young people. Or D, early identification and support. Can we have the poll, please? Lots of results are still coming. We will give you 20 more seconds. Can you please respond in the poll, not in the chat, please? Thank you so much. Can we move on to the third question and the last one? In relation to pharmacists working in mental health, which of the following statements is correct? A, there are many studies have been derived from developing countries. B, in Brazil, there are recommendations in official government documents that guarantee the presence of the pharmacist in mental health teams. C, There are studies of patients with mental illnesses showing that pharmaceutical care contributes to achievements of therapeutic goals like medication adherence, treatment satisfaction, and reduction of depressive and anxiety symptoms, or D, international institutions don't have supported and encouraged the introduction of pharmacists into multidisciplinary healthcare teams in mental health. Once again, please answer to the question in the poll and not in the chat. Take 60 seconds to the end. Thank you so much. Thank you so much for your participation. And I want to tell you that the recording of this episode will be made available on our website. And please provide your feedback to webinars@fip.org so FIP may continue to improve their digital events offering. Visit events.fip.org for all future events. One last thanks to our attendants and to our brilliant speakers, Dr. Sheila, Dr. Claire, and Dr. Ailey. See you soon and bye-bye.